All right, final thing. You heard me just say it. Hope leads to wellness. We believe it so strongly. And actually, in our first years of working in rare disease, and we would talk about hope, I got some kickback. And I know you do, too, sometimes in your Facebook groups and patient communities. If someone shows up too hopeful, people can sometimes squash them down. Like, let's not make light of how serious this living with this disease is, right? But hope has to be a part of the equation. And we know that it is emotional whiplash, right? From hope to despair. You can get one piece of good news. Oh, I've got, the clinical trials got approved. And then 2 weeks later, your neurologist is retiring. It's going to be like that constant whiplash within the rare disease journey. And that has to be normalized. You're not going to show up hopeful every day. That's okay. But a persistent pulse of hope in your life is what we believe really leads to healing. It rises when you are connected with others. When we look at peer support groups, this is one of the number one indicators of increased mental health, is asking people how connected they feel to the others in the group has a direct correlation to how well they're feeling overall. We know hope instills optimism, it builds confidence, it inspires the kind of healing that we all need. Also can foster recovery. Again, if my partner who's had a neck fusion doesn't believe that the neck fusion's really going to work, right? And now we're in recovery, and his constant is just like, yeah, we'll see. I don't know, the pain's still there. It didn't solve, the stimulator didn't solve it. The neck is not going to solve it either. We're not even going to be able to weed through what's physically happening because emotionally, he's going to perceive every cramp, pain, glitch as failure, right? Treatment failure. We have to stay hopeful so that we can actually see reality across the board. And then we love this visual. What I just want to leave you with is just, where are you on that continuum of hope, and where do you want to be? Are you feeling like you're struggling? Do you want to move towards being generally hopeful? Some of these practices we've talked about today are accessible to you. Work on the way that you talk to yourself. Take time for yourself. Give yourself a break. Be in community with others. Cherish connections, small and long term. And then you have to really hold on to a sense of optimism that the experience is going to bring you some type of joy, love, connection, relationship. There is a purpose. There is a purpose. And I think when we get to a place where we feel overwhelmed, we can live our lives feeling as victims rather than as authors of our experience. And that's really hard in rare disease because there's a lot of systems trying to put you down and hold you back from living the full life that you want to lead. But we believe so strongly that communities and patient health organizations are the types of places and spaces where people can really grow. So we have all kinds of tools at Given Hour. Patient Health Alliance has a whole toolkit that we've helped them develop that will be a resource always available to you. I'm so excited. I just want to announce that we are going to be having a year from now the first ever Rare Mental Health Summit. So if mental health is something that's really interesting to you, you want to be with others to talk about having a rare disease, caregiving in rare disease, and all the things that it brings mental health-wise. We'll have mental health clinicians there, industry folks there. We'll have researchers and advocacy. We're actually working on a national advocacy agenda around rare mental health. And if you want to get in touch with me, or you can't capture this now, Corey and Kim, Dan also knows how to get in touch with me, please reach out. I'm always here to support you. I'm so grateful for the time I had with you today. I'll be on the panel later, too. Thank you.